Good day, everybody. I'm here to present the topic food therapist. Who is a food therapist? Yes. By way of introduction, my name is Odion Obumesi, a trained medical scientist with specialization in histopathology. That made me a disease specialist. Also, I'm a food therapist, author of Tradocracy and other books, medical books, novel, poetry, socio-political books, and philosophical books. Today, I shall be talking about who is a food therapist. You cannot just be a food therapist without having detailed ground knowledge in medical science and also having ground knowledge about therapeutic indices of food, the treatment values of food. Because the therapeutic indices of food or the treatment effects of food is grossly different from the nutritive aspect of foods. Yes, having these two ground knowledge is when you can claim to be a food therapist. Because food therapist is just about the systematic usage of food to treat diseases. And you don't just come up, if you are, for instance, you're a medical doctor, although you're only grounded in medical sciences, which means such person is trained to use synthetic drugs, mainly to treat. Such individual is not trained to use food for treatment. Yes. Individuals that may be close to food therapists are people maybe having degrees in natural medicine and all that. So such persons mainly use herbs for treatment. But this time around, we are talking about foods and foods mainly. Yes. The reason why such individual must have detailed knowledge in medical sciences, a ground knowledge in medical sciences, is that one must be able to know the pathological sequence of a disease, the morphology, the clinical cause of a disease changes, how disease change in the body, and what food that can be tailored to follow up the changes. Even in the course of treatment, there is also changes of certain lesions or the disease you are treating, the changes in the body. And the follow-up of such changes matters a lot. So if you do not have a grand knowledge in medical science, you will not be able to tailor food to treat diseases. For instance, neoplastic lesions. I'm talking about some of these cancer genesis. There are certain foods that are tailored. Cancer can arise from different parts of the body. There could be colon cancer, liver cancer, blood cancers, prostate cancer or prostate tumor, BPH, and all that. So anything neoplastic, you see, there are foods that can be tailored depending where the cancer arises. Yes. Some foods has one, chemical effects and antibiotic effects on certain lesions, on certain diseases. Yes, and some of these food that have a gross chemical effects on neoplasms and antibiotic effects on neoplasms, and also such foods tendencies of boosting immunity. Such food can always be tailored to treat cancer genesis. They are enormous. Yes. One of such food is raw onions. There are other foods, yes, that can be tailored depending on the disease sequence or depending where the cancer is arising. For example, prostate afflictions. You see, ugu itself, what they call pumpkin, mainly pumpkin seeds and the fruits are highly therapeutic against prostate afflictions. Whether BPH, whether benign prostatic hyperplasia or prostate carcinoma, prostate cancer, I mean. Yes. You see, in treatment of diseases, apart from maybe having a background training in medical schools and all that, that experience must be there because some foods are hypotensive in nature. Yes, while some food are hypertensive in nature. If, for instance, individual is hypotensive, hypotension is a low blood pressure. It's different from hypertension. So if individual has hypotension, such individual is always having a low blood pressure. Such person must run away from food that have diuretic ability. Diuresis foods, they are enormous. Foods like watermelon, apple, citrus food like oranges, lemon, tangerine, all citrus food, and garden egg, because they are diuresis food. When such individual who is hypotensive, who has a low blood pressure, takes such food, don't be surprised that person will be having crisis, and the person will know the reason why he's taking drugs to elevate his hypertension to a comfortable level, but yet there's no response. And that person wouldn't know that the food is eating, watermelon, oranges, and all that. He ought not to eat it. And such person should also abstain from sleeping drugs. Yes, because sleeping drugs reduce BP. So individual with low BP does not need further reductions. Yes. But if an individual is hypertensive, that is high blood pressure, all this watermelon, citrus food, and oranges, tangerine, apple will be very good for treatment of such ailment, treatment of hypertension, because, like I said, they are diuretic in nature, and all diuresis agents reduce BP a bit. Yes, so if such individual is hypertensive, has hypertension, and start taking this food I mentioned above, such person might be getting reliefs. Yes, but there are other food, stronger food, to be taken alongside with this diuresis food that are directly meant for treatment of high blood pressure. Yes, and again, as we are trained in school, a lot of us who have no experience, a patient came for maybe the same low BP problem and all that. Inexperienced doctor, maybe the patient complain of body pains, headache, and all that. Inexperienced doctor may just place the person primarily before other drugs. Could just place the person on pain relieving drug, analgesic, like paracetamol, ibuprofen, or pain relieving drugs. And when such doctor does that, that patient is likely to have more clinical problem. Is likely to have a major problem because all analgesic, all pain relieving drugs like acetaminophen is paracetamol, has little effect on reduction of BP. And because it has little effect on reduction of BP, such individual who already has low blood pressure and you are giving paracetamol, such person could collapse. Yes. And such doctor may not even realize that maybe the paracetamol or the pain relief drug he gave induced such collapse because he will be feeling that he gave a normal drug. In a lot of cases, in most hospitals, people will be suspecting induced secrecy. Induced secrecy is abnormal reaction to a normal dose of drug, whereas actually it's not an idiosyncratic reaction. It is drug reaction due to the BP drugs, due to the pain-releasing drugs such person took, he ought not to take. Yes. See, that's the reason why a food therapist should have a ground knowledge in medical sequence, in clinical sequence of drug, a ground knowledge in pathology, and the systematic usage of this food based on disease presentations and all that matters a lot. Because if you are not grounded, first of all, in the treatment value of food, are not grounded in medical and you don't have medical background, you cannot claim to be a food therapist. Yes, because when you say food therapist, you are talking about treatment of diseases using food. Yes, modern medicine use synthetic analogs, use drugs to treat. Yes. So today I'm advocating for food therapy because it has reduced or no side effects. Yes, I may be the first person or one of an individual who is advocating and promoting food therapy because side effects of drugs have actually affected a lot of persons. Yes, and cause and a secondary disease. The new world order is to embrace food therapy. Embrace food therapy and be safe from drug side effects. Drugs are still very good for treatment of diseases. But I'm believing that by the time we are so aware about the medical indices of foods, its treatment values, we will embrace more of food therapeutic pattern of treatment. Thank you very much for listening.